So, what is pneumonia? Pneumonia is a respiratory infection that causes our lung air sacs to be filled with either pus or other fluids. Most of the time, pneumonia can affect either one or both lungs and can honestly range in severity from mild to life threatening depending on the situation. And moving forward, what causes pneumonia? Well, pneumonia can either be caused by bacteria, viruses, or fungi. Essentially, bacteria is the most common cause of bacterial pneumonia in the U.S., specifically Streptococcus pneumoniae. And for viruses can also cause pneumonia. For example, COVID-19 and other colds and flus as well. And lastly, fungi. Well, this type of pneumonia is the most common amongst people with chronic health issues or weakened immune systems. And fungi is really dependent on geographic location and is typically found in soil or bird droppings. Some signs and symptoms of pneumonia are fever, shortness of breath, fatigue, nausea, chest pain, tachycardia, and most of the times people see either a dry or productive cough. Now, these are just some of the symptoms and signs of pneumonia, but there are many others. Not necessarily listed here on the list, but as you can see on the picture, for example, loss of appetite, low energy, fatigue, sweats, chills, confusion, headache, you name it. So pneumonia is a pretty broad disease that comes with many different types of signs and symptoms. Now we ask the important question, who is at risk of pneumonia? Well, everyone can catch pneumonia, so everyone is at risk for it. However, children, elderly, specifically those over the age of 65, and people with underlying health issues or weakened immune systems are mostly at risk. Pneumonia is, in fact, the number one reason of deaths among children across the world, with an estimated 15% being under the age of 5. So the environment these kids are growing up in is very important. The nutrition, making sure they're not malnourished. And for the elderly specifically, a lot of them who have pre-existing lung diseases, even also a dysfunctional spleen, or if they've ever smoked or abused of alcohol, or have immunosuppression. So all of these are factors that make people at risk, but specifically children and elderly are the most susceptible, including those with weakened immune systems.
So, what can you do to prevent contracting and spreading pneumonia? There are many things we can do to stay healthy and to help prevent diseases. The American Lung Association outlines 4 key actions we can take to prevent pneumonia. So first is getting the flu shot. This is really important because pneumonia is spread and contracted when our immune systems are lowered. So when we get the flu shot, it helps lower our risk of getting the flu and getting sick for that season, which also lowers our risk of contracting pneumonia. So the healthier you are, the less likely you are to get pneumonia. And number 2 is washing your hands. Of course, we all know this. Washing our hands is the number one way we can help to prevent the spread of diseases. So make sure you wash your hands and avoid touching your face, touching your eyes, and just staying aware, always washing your hands after you touch doorknobs, going to the bathroom. And then third, the American Lung Association recommends avoiding smoking. So pneumonia. And then third is to avoid smoking. Of course, pneumonia is a lung infection, and smoking affects our lungs. It is the number one cause of lung cancer, and there is a lot of scientific evidence to support how bad smoking is for our lungs. So either avoiding smoking or stopping smoking, if you are able to, are great ways to avoid getting pneumonia. And then lastly is just to stay aware of our health. Like I said before, pneumonia is contracted typically when our immune systems are already lowered, especially if we're an older person. So what we can do is just make sure we're eating healthy, getting enough rest, getting exercise, and just reducing our stress can help to keep our immune system strong, and then that way we can help to avoid pneumonia. And more information is provided in the next slide about access in our local community to help stay on top of these health habits. So this slide is all about resources that we have in our local community that are all ways that we can help stop the spread of pneumonia. And the first one is the CalFresh program. So it's the CalFresh Healthy Living Program, and it's funded by the USDA's Supplemental Nutrition Assistance Program. And this is through the Department of Public Health. It's actually the largest nutrition education program in the United States, and more than 1/3 of California residents are eligible for the CalFresh Healthy Living. They offer critical resources to lead a healthier life, and they provide opportunities to enjoy fresh produce, which a lot of communities in lower socioeconomic areas don't have access to fresh produce. So if you're living in an area that you feel like you don't have a lot of access to healthier options in terms of food, or maybe you can't afford it, more than 1/3 of California residents are eligible. So look into that. There's a website right there. You can go to calfreshhealthyliving.com, and you can utilize these services, which can promote a healthy immune system, and they can reduce your risk of pneumonia. We have the flu shots that are available on solvehealth.com, which is a website that shows you free facilities in your area that offers the flu shot. So this is great if you're like, I want to get the flu shot, but maybe I don't have access to healthcare, or I'm not sure where to go. You just log on to this website that's provided on the slide, and they'll show you all the areas around you that offer free flu shots. And then the other thing is the STOP program. It's the Smoking and Tobacco Outreach Prevention Program. And this is a free program through the San Joaquin County Public Health Office that provides free resources and education to promote smoking cessation. So you can become a member on the San Joaquin County Public Health Office website. There's also a phone number on this slide if you would rather call. And again, this is a program that's free. They provide resources and education so that to help you stop smoking if you need extra support. So Healthy People is an initiative that aims to improve our healthcare system overall, and they put goals on their website. Usually they have milestones for every 10 years with goals that they're trying to hit to just improve our healthcare system overall. And while the Healthy People 2020 objectives do not have any explicit pneumonia-related goals, they do have subgenres which relate to pneumonia. One of their core goals were to reduce respiratory disease. This includes pneumonia, of course, as it is so common. Within the respiratory diseases section, the website has a section titled Reduce the Rate of Hospital Admissions for Pneumonia in Older Adults. Interventions for Healthy People 2020 are tailored to at-risk groups, which can also help prevent and treat other respiratory diseases, such as pneumonia. The website writes that current admissions stand at 713.9 pneumonia admissions per 100,000 older adults. The goal is to lower that number to 642.5. The website also states that older adults are more likely to get pneumonia and to be hospitalized for it. Pneumonia is also a leading cause of death for older adults. Making sure older adults get the flu shot and pneumococcal vaccines and encouraging people to quit smoking can help reduce hospital admissions for pneumonia. So again, we can see the same goals that the American Lung Association outlined for reducing pneumonia. And on this slide is a just like a graphic to show, the deaths from pneumonia worldwide. And although it has gone down, it is still a very big number. So pneumonia is a very big topic in improving our healthcare system, and Healthy People 2020 does outline that when they talk about tailoring respiratory diseases to at-risk groups and reducing hospital admissions for older adults with pneumonia.
Pneumonia can affect people of all ages and lifestyles, therefore, it is essential to become aware of its signs and symptoms and how to best protect yourself. Having a healthy lifestyle is most important, ensuring to avoid smoking or quitting if you currently do, having good hand hygiene, getting plenty of exercise, getting your flu vaccine or keeping up to date with your vaccines, and taking precautions to boost your natural immune system are all recommended to reduce the risk of infection. Be sure to reach out to community resources for more information if you need on how to reduce your risk, and contact your healthcare provider if you suspect you may have come into contact with someone with pneumonia or if you've noticed signs and symptoms of infection. Stay safe.